Hello, my name is Lainey Rand, and this is going to be my video for my assignment 1, treating a skin cancer patient. So I'm going to go ahead and greet my patient and go over the Mohs surgery as if he or she were right in front of me. Okay, so my name is Lainey Rand, and I'm going to be your nurse during this Mohs surgery. How are you feeling today? Do you feel ready for your upcoming surgery? Well, if you don't have any more questions, I'm going to briefly go over the purpose and the goals of Mohs surgery. So Mohs surgery is a pretty advanced technique. It's also known as micrographic surgery. It's a precise surgical technique done in stages to treat skin cancer. The procedure involved in the effective method permits healthy tissue to be spared as much as possible while leaving the smallest scar as possible as well. The other word for scar is called cicatrix. So if you hear that being used, that's talking about scarring. So lab work is done in stages while the patient waits between each stage. This allows for the highest cure rate made possible for the patient by performing the procedures in order based on the steps. So the number of steps vary depending on the progression of the cancer, depending on if there's a little amount found or if there's more than there was thought, and so on. Curing the patient along with healing is the two main essential goals of the surgery. So there's the two most common types of skin cancer. One's called basal cell carcinoma, and the other one is called squamous cell carcinoma. They're both typically effectively treated by performing Mohs surgery. In your case, your diagnosis is going to be the basal cell carcinoma. So skin cancer developing in the basal cells are thought to be caused by long-term exposure to UV radiation from sunlight. And the basal cell carcinoma, that starts in the basal cell, so that's where it develops. Basal cell carcinoma are a specific type of skin cancer that begins in the basal cell. So it's a type of cell within the skin that produces new skin cells as the old ones die off. Basal cell carcinoma often appears as a slightly transparent bump on the skin, though it can take different forms. So the area of the skin that have the most exposure to sun, like your neck, your face, if you have your hair up a lot, your ears even, are where the types of skin cancer is mostly found, or the basal cell carcinoma is mostly found. During your Mohs surgery, there is going to be more than one doctor performing the Mohs surgery together because of all the stages that there are for the effectiveness. So the Mohs surgery, basically, there's mainly 3 people to perform 3 very important roles. There'll be a surgeon who removes the cancerous tissue, a surgeon who who closes and reconstructs the wound, and then a pathologist who analyzes the lab work while you wait in between the stages. So the dermatologist, pathologist, and Mohs technical members all work together to ensure the success of the Mohs surgery. So that's pretty awesome. A lot of people working together that are very knowledgeable in this area. So in the Mohs surgery, like I said, it's a procedure performed in stages. These stages are completed all in one visit. So first, they're going to be using a scalpel, and your doctor will remove a thin layer of tissue that's visibly infectious. And so the tissue will then be placed on a microscope slide to be thoroughly examined using a microscope. And that's where the pathologist comes in. The tissue being removed will be carefully examined thoroughly, and it's a mapping technique that they use, so nothing's going to be missed. If any cancerous cells remain, your doctor will let you know before they remove a second layer of tissue. And also, of course, more anesthesia will be injected if needed. Let's see. The wound may be left open to heal, or the surgeon will decide to stitch up the wound after the site of cancerous cells are clear. If more than one round is needed, the entire procedure can take up to several hours. The highest amount of healthy tissue can be saved by the precise process, allowing the smallest scars as possible. So, keeping this in mind, the lengthy amount of time that it might take to complete the surgery is well worth it. Trying to get, the smallest amount of tissue taken and allowing the smallest scar if possible. I mean, a scar will be left after the wound heals, of course, but as far as how big or how small it is going to be based on the progression of the cancer and following these precise stages during the surgery. For this reason, along with infection and reoccurring cancer, it is vital to care for your wound correctly. So in order to care for the wound, I'll go through some steps to help you out so we can, eliminate anything that might be problematic. So after your surgery, it's normal to feel discomfort after your surgery, of course, including swelling, maybe some bruising. It's been told, and people have came back and said it, using cold compresses has helped, and over-the-counter pain medicine. So definitely that's an okay to do. You want to kind of get as much rest as possible because that's where your body's going to be healing at the fastest rate. You want to avoid active work or exercise for about 24 to 48 hours if possible, and that's at the minimum. You got to protect yourself from sun. Of course, when you have a new wound, not protecting yourself can increase the risk of new cancer cells to form. And then, so as far as your the site of the wound, you want to keep the area covered as it will be after surgery. Well, you want to keep the area covered, and then after surgery is completed, you're able to move, take that wound off after 2 days. After 2 days of the surgery. Always clean your hands before removing the bandage and cleaning the wound. And then after the removal of the bandage, clean the site with a half of peroxide and then half water. Then you can use like polysporin. You can use, not Neosporin, there's tri-antibiotics, but that should always be applied after because it's essential to keep the wound clean, free from dry blood and scabbing, and then moist. After cleaning your wound, make sure to put a clean bandage back on the site, and then never use your old ones. Discard of those. Complete healing of a surgical scar normally takes place after the 12th to 18th month after surgery. Carefully follow your doctor's instructions for wound care, scar care, and follow-up to achieve the best outcomes. Your schedule for your follow-up visit will need to be every 6 to 12 months, and then it is recommended to kind of examine your own wound as well, looking for any changes where the cancer was treated, and then don't forget to check the spots where there's most where there has been a lot of skin exposure to see if you found any new places that you might be concerned about or might be worried about, so we can check those as well. So that's going to be the main focus after your surgery, and I hope everything goes well. We'll be with you before and after and can answer any more of your questions, and just know that you're in good hands. Thank you so much.